I received the Junior Investigator Award from the International Aspirin Foundation. As you know, the aspirin can prevent aspirin use can prevent the colorectal cancer risk, but it does not work for everyone. So probably there are some genetic markers that can define people who may or may not get the exact benefit by aspirin use. So my research has been focused on identifying those genetic markers that can define population groups who can get the benefit from aspirin use. And we did this kind of research using the gene-environment interaction study for colorectal cancer, and we examined around more than 2.7 million SNPs. It is kind of the single nucleotide polymorphism genetic variants across the whole human genome with interaction for aspirin use and other non-steroidal anti-inflammatory use for colorectal cancer. And very interestingly, we found a genetic variant, a small group of population, like 9% of population, who have the genetic variant on chromosome 15, they may have no benefit by using by use of aspirin for colorectal cancer. What's more is that a small number of population, like 4% of participants, who have the rare variants on chromosome 12, if this small population group use the aspirin, can increase the risk of colorectal cancer. So in other words, the aspirin may have even an adverse effect for colorectal cancer prevention in a small group of population. So this is our major finding. In my genome-wide gene-environment interaction study, we included more than 8,500 colorectal cancer case control pairs that have been ongoing more than 4 decades in 4 different countries. So this is the big population group in colorectal cancer from the Colorectal Cancer Consortium. Of course, by genotyping of this one single nucleotide polymorphism that we identify in our study, is unlikely sufficient to do the direct targeted clinical care for colorectal cancer. But the advantage of our study is that if our findings validated in additional study may promote the targeted prevention of colorectal cancer. And based on our study, we can further develop the additional investigation, and we can identify more genes related to the aspirin and the colorectal cancer prevention. So I think our study can motivate the future investigation, and in the future, the clinicians may use a panel of genes, not like the only one gene, a panel of genes to better decide their recommendation for individual patients. So this study can contribute to the the precise medicine strategy. We have several plans about that. So first we can, because we just identified a single polymorphism related to aspirin and colorectal cancer, but we do not know exact underlying mechanism of this SNP for the colorectal cancer pathway. So probably we can do further functional study to document if this SNP is related to, may alter some specific genes then further related to aspirin and colorectal cancer. And on the other hand, now with a number of new technologies that enable analysis, the whole genome analysis, so we can further conduct some integrative analysis. For example, we can incorporate the GWAS data and the whole genome gene expression data and identify some biological pathways that related to colorectal cancer, and further examine the interaction between this kind of identified pathways and like environment like aspirin use on risk of colorectal cancer. So what the advantage of this kind of study is that because the identified biological pathways may include the multiple genes, not only one gene. So using identified these pathways, we can help the clinician to better decide the recommendation, tailor the recommendation of individual patient. Another future plan we can do is that, as I mentioned earlier, probably can confirm our findings in additional studies. So, in other words, we can conduct another validation study, and once we confirmed our result, we can consider to use this finding to the clinical care. Aspirin use many epidemiologic studies and randomized clinical trials suggest that aspirin use may prevent the colorectal cancer. But as you know, the aspirin has side effects like bleeding. So this kind of hazard of aspirin is also very important to consider when we want to use the aspirin. So I think in the future we can make balance and take into account the both benefit of hazard of aspirin use, and based on their balance, we can decide if a patient is better to use aspirin or not. So I think our study is just the beginning for personalized prevention strategy. So in the future, we need to do more and more studies, as I mentioned earlier, so to better make a decision for patient care.